Let's talk about the recent summer surge in COVID, showing to be trending down with wastewater levels declining nationwide and here in California. A relief for some, for sure. But for the immunocompromised, disabled, and chronically ill, life remains the same as it did at the start of the pandemic. But how? In tonight's The Answer, we do a deep dive. You're about to hear from Sacramento disability advocate Charis about these past 4.5 years and what they want others to know about being disabled in the pandemic.
I was the definition of active when I was younger. I ran road races, I played volleyball, I played softball, I played soccer. But in 2013, I was diagnosed with axial spondyloarthritis, which is, it's a disease that my dad had. It's a systemic disease that creates inflammation primarily in joints, like large joints, especially in the spine. There are only treatments to slow down that progress. There's no cure presently. The medications that I take to slow down progression of my axial spondyloarthritis suppress my immune system. I would wear masks in high traffic settings where I thought that there would be more viruses present. I began modeling around the time I was diagnosed. I've modeled in New York Fashion Week, Los Angeles Fashion Week, of course, Sacramento Fashion Week. I've been on several magazine covers for my modeling. I was elevated in my modeling career because I was openly disabled. I was traveling a lot to advocate, so I would travel to DC to talk with members of Congress. I would travel to medical conferences where I would, attend scientific sessions and report out. That was my last time feeling free.
It's a virus that hasn't been seen before.
The CDC says this is a new disease that's spreading through people.
It's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will become infected.
Normal pre-pandemic was never good for disabled people, so I didn't have much hope, even if we did a good job. I can count on one hand the number of people I have hugged. I can count on one hand the number of times I've entered a grocery store, and a majority of those times were for vaccinations. I don't feel safe going to the doctor office, which is kind of ironic. The way public health policy has worked has made it so that it is not safe for me to be anywhere else. Medically, I'm getting worse. From the very start, people like me have been labeled as not worthy of saving.
The overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities. So really, these are people who were unwell to begin with.
I don't think people are aware how much that beats down on you. It's hard to feel like a human. Knowing that people don't see you is valuable.
Is the pandemic over?
The pandemic is over.
Everyone's being told that it's over, but I want people to know that it's still going and you're leaving people behind. And I'm one of those people. People who are not disabled say they need a break because their mental health is suffering, and I don't doubt it. But nobody's, acknowledging the impact on people like me.
According to the CDC, up to 1 in 4 U.S. adults have some type of disability, adding that people with disabilities are at greater risk, of course, of getting long COVID. Long COVID can qualify as a disability under the Americans with Disabilities Act. About 15% of U.S. adults have experienced long COVID symptoms.